Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Breast lumpectomy and sentinel lymph node biopsy. Introduction. Breast cancer is a common condition that affects millions of women every year. It usually shows up as a lump that can be felt and/or seen with a mammography. Your doctor may recommend surgery to remove it and to test some of the surrounding lymph nodes. This is called a breast lumpectomy and sentinel lymph node biopsy. The decision whether or not to have this surgery is yours. This program will help you better understand breast lumpectomy and sentinel lymph node biopsy. The program explains the anatomy of the breast, lists alternative treatments, explains its benefits and risks, and what to expect after the procedure. Anatomy. The breast has glands responsible for making, storing, and delivering milk. Breast milk is made and stored in the glands inside the breast tissue. From the glands, milk flows through special ducts to the outside, passing through the nipple area. The breast rests on a chest muscle called the pectoralis major. All the nerves going to the arm pass through the axilla or armpit region. Important arteries and veins also pass through the axilla. Lymph, a nearly clear fluid produced by the body, drains waste from cells. It travels through the lymphatic system, which is made up of channels and bean-shaped structures called lymph nodes. The lymphatic system drains excess fluids and waste. The underarm area contains many lymph nodes. The lymph nodes in this area are specialized structures that allow lymph to drain away from the breast area and the arm back to the bloodstream. Lymph nodes play an important role in fighting infection, but breast cancer could spread to other parts of the body through lymph nodes and lymph channels. Alternative treatments. If a breast lump is cancerous, the treatment includes one or more of the following. 1. Surgery. 2. Radiation therapy. 3. Chemotherapy. 4. Hormonal therapy. 5. Targeted therapy. 6. Immunotherapy. Examples of breast cancer surgery include lumpectomy, total mastectomy, radical mastectomy, modified radical mastectomy. Which treatment your doctor recommends depends on the type of cancer you have as well as your age and condition. Your doctor will help you figure out the best treatment for you. This program explains the benefits and risks of lumpectomy and sentinel lymph node biopsy. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Surgical treatment. The operation to remove breast lumps as well as test and remove affected lymph nodes is known as lumpectomy and sentinel lymph node biopsy. Its purpose is to 1. Take out the cancerous lesion. 2. See if the cancer has spread to the underarm lymph nodes. First, the breast lump is surgically taken out with some healthy breast tissue surrounding it. This is known as lumpectomy. Normally, there are many lymph nodes in the armpit. Because the lymph nodes in the armpit also help drain lymph from the arm, taking out all these lymph nodes could lead to long-term swelling of the arm, known as lymphedema. In order to prevent this complication, surgeons try to remove the fewest number of lymph nodes possible and check them for cancer. Doctors use a procedure called lymph node mapping technique to decide which lymph nodes need to be taken out. Before an operation, a dye is injected in the area of the tumor. The dye moves through the lymphatic system to the lymph nodes of the underarm. The first lymph node, or lymph nodes, to pick up the dye are known as sentinel lymph nodes. If the cancer has spread to the lymph nodes, the sentinel nodes are more likely than other lymph nodes to have cancer. Two types of dye can be used. One is a radioactive material, not harmful, usually injected by a radiologist in the area of the tumor before the surgery. The other dye is a blue dye, usually injected by the surgeon 10 minutes or so before the operation after you are asleep in the operating room. A radioactivity detector is used if radioactive dye was injected to identify the sentinel nodes. If your doctor used the non-radioactive blue dye, he or she will visually find the sentinel nodes. The sentinel nodes are taken out during surgery. They are sent to a pathologist who looks at them under the microscope while you are still under general anesthesia. If no cancer is found in these lymph nodes, the operation is over and the surgeon closes the incisions. If cancer is found in the sample, the surgeon may remove some of the remaining lymph nodes and may place a drain. Risks and complications. This surgery is very safe. There are, however, several possible risks and complications. These are unlikely, but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Treating deep infections may require long-term antibiotics and possibly surgery. 2. Bleeding, either during or after the operation. This may require a blood transfusion or another operation. 3. Fluid may collect under the skin, which is known as seroma. This fluid may need to be taken out with a needle or another operation. A seroma could cause the incision to open up. 4. Skin scar that may be painful or unsightly. 5. A second surgery may be needed to completely remove the nodes. Other risks and complications are related specifically to this surgery. These, again, are very rare, however, it is important to know about them. The more extensive the surgery, the higher the risks and chances of complications. However, complications are still rare. Even the simplest operation may change the way the breast looks. Nerves running through the axilla may be injured, causing shoulder or arm weakness, loss of sensation, or arm pain. This is rare. The arteries and veins running through the axilla may rarely be injured. More surgeries may be needed to take care of such injuries. When underarm lymph nodes are removed, the arm on the side of the operation may swell. Occasionally, the use of an elastic arm stocking or other methods might be needed to reduce the swelling. This swelling is also known as lymphedema. After the operation, some patients feel down because of the diagnosis and because of the disfigurement. Even though this is normal, you should let your doctor know about these feelings. Counseling, support groups, and breast reconstruction is available and may be helpful. After the surgery. After the operation is done, you will be moved to the recovery room and then to a regular room. You may go home the same day, depending on how extensive the operation was and how you are doing. Depending on the pathology reports from the surgery, as well as other tests, further treatment may be needed. This could include 1. Radiation therapy. 2. Chemotherapy. 3. Hormonal therapy. 4. Additional surgery. 5. Possibly immunotherapy. Make sure to call your doctor if you get any new symptoms, such as a fever, wound drainage, severe pain, weakness, swelling, or infection. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Breast cancer is a common condition that affects millions of women every year. Which breast cancer treatment your doctor recommends depends on the type of cancer you have as well as your age and condition. Your doctor will help you figure out the best treatment for you. Doctors may recommend surgery to remove breast cancer. They may also recommend removing and testing the lymph nodes in the armpit area to make sure the cancer has not spread to them. An operation known as lumpectomy and sentinel lymph node biopsy may be recommended to 1. Take out the cancerous lesion. 2. See if the cancer has spread to the underarm lymph nodes. Breast lumpectomy and sentinel lymph node biopsy is very safe. Risks are low and complications are very rare. Knowing about them may help you detect and get them treated early if they happen. Thank you for using Explain.